The decision to move to a nursing home is often one of the most emotionally complex and life-altering choices an elderly person can make. While it may seem like a practical solution for ensuring safety, medical care, and social engagement, many seniors who transition to nursing homes later express regret about their decision. This regret stems from a combination of psychological, emotional, physical, and social factors that are deeply intertwined with the human experience of aging. Understanding why the elderly regret moving to a nursing home requires examining not only the institutional environment, but also the broader cultural perceptions of independence, dignity, and personal autonomy. One of the primary reasons elderly individuals regret moving to a nursing home is the profound loss of independence they experience. For most people, maintaining control over their daily lives, whether through managing their own schedules, cooking meals, or simply deciding when to wake up, is a fundamental aspect of self-worth. Nursing homes, by their very nature, impose structured routines and rules designed to ensure efficiency and safety. While these structures are necessary in some cases, they can feel restrictive and dehumanizing to residents who are once accustomed to making their own decisions. The inability to perform simple tasks without assistance can lead to feelings of helplessness and frustration, exacerbating the sense that they have lost agency over their lives. Another significant factor contributing to regret is the emotional isolation many seniors feel after moving into a nursing home. Despite living among other residents, loneliness remains a pervasive issue. Many older adults leave behind close-knit communities, lifelong friends, and familiar neighborhoods when they relocate to a facility. Even if family members visit regularly, the visits may be infrequent or insufficient to fill the void left by the absence of meaningful connections. Furthermore, the communal living arrangement in nursing homes does not always foster genuine relationships. Shared spaces can sometimes breed tension rather than camaraderie. As a result, seniors may struggle with feelings of abandonment and alienation, which can profoundly affect their mental health. Nursing homes often strip away elements of personal identity that contribute to a sense of belonging and purpose. Personal belongings, cherished mementos, and even pets, things that provide comfort and continuity, are frequently limited due to space constraints or institutional policies. Residents may find themselves adapting to generic furniture, sterile decor, and impersonal environments that lack the warmth and familiarity of their former homes. Over time, this disconnection from personal history and individuality can erode a person's sense of self, leaving them feeling as though they've become just another resident, rather than a unique individual with a rich life story. There is also a societal stigma attached to moving to a nursing home, which can weigh heavily on seniors. In many cultures, including Western societies, there is an implicit expectation that adult children will care for their aging parents at home. When this ideal cannot be achieved, whether due to financial limitations, caregiving burdens, or health concerns, seniors may internalize a sense of failure or inadequacy. They might interpret their move to a nursing home as evidence that they are no longer valued or needed by their families. This perception can be compounded by guilt, shame, and fear of being forgotten, all of which contribute to regret and dissatisfaction with their new living situation. While nursing homes are intended to provide high-quality medical care, the reality is that some facilities fall short of expectations. Poor staffing ratios, inadequate training, and understaffed teams can lead to substandard care, neglect, or even abuse. Additionally, the sedentary lifestyle typical of many nursing homes can accelerate physical decline, as residents may spend long hours sitting or lying down without sufficient opportunities for movement or exercise. Cognitive decline can also worsen in such settings, particularly if residents lack adequate stimulation or engagement. For those who entered the nursing home hoping to improve their quality of life, witnessing their health deteriorate further can deepen their regret and disillusionment. For many seniors, Moving to a nursing home represents a significant financial sacrifice. High costs associated with care and deplete savings force the sale of family homes or place undue strain on loved ones. The realization that years of hard work and financial planning have been consumed by healthcare expenses can evoke feelings of resentment and regret. Moreover, the loss of their home, a place imbued with memories and sentimental value, can compound these emotions, creating a sense of irrevocable loss. Generational attitudes toward aging and elder care play a crucial role in shaping how seniors perceive nursing homes. Older generations, particularly those raised in the mid-20th century, often view institutionalized care as a last resort, equating it with surrendering autonomy and dignity. Younger generations, however, may see nursing homes as a viable option for ensuring safety and access to professional care. These differing perspectives can create tension between seniors and their families, with the elderly feeling pressured into a decision they do not fully support. Such conflicts can amplify regret and reinforce negative perceptions of nursing homes. It's important to acknowledge that not all elderly individuals regret moving to a nursing home. For some, the benefits outweigh the drawbacks. However, addressing the widespread feelings of regret requires rethinking how we approach elder care. Promoting alternatives such as assisted living facilities, in-home care services, or community-based programs could empower seniors to maintain greater independence while still receiving necessary support. Improving conditions within nursing homes through increased funding, better staff training, and more personalized care plans could also mitigate some of the challenges faced by residents. Above all, fostering open communication between seniors and their families about preferences, fears, and expectations is essential to ensuring that decisions align with the individual's values and desires. In summary, the regret experienced by elderly individuals who move to nursing homes rises from a complex interplay of factors, including the loss of independence, emotional isolation, disconnection from personal identity, societal stigma, declining health, financial burdens, and generational differences. Addressing these issues requires a multifaceted approach that prioritizes dignity, autonomy, and holistic well-being. By reimagining elder care models and placing greater emphasis on preserving the humanity of aging individuals, society can help reduce the regret and dissatisfaction that so many seniors associate with nursing homes. Ultimately, the goal should be to honor the wisdom and contributions of our elders by providing them with options that respect their choices and enhance their quality of life during their final years.